The word tattoo is believed to have two major derivations. The first is from the Polynesian word, ta, means striking something, and the second is the Tahitian word, tato, means to mark something. The oldest example of tattoo dates back to 3000 BC and is represented by a 5,300-year-old mummy, called Otzi the Iceman, discovered in 1991, which has over 50 black tattoos.
Tattoos can be classified into a few categories, namely, professional, amateur, traumatic, cosmetic, decorative or medical. Tattoos can be made by amateur or professional artists. Amateur artists use Indian ink, charcoal or soot or ash powder on a common needle or a nail instead of the special needle used for tattooing. These tattoos have a poor artistic quality and pose a risk of infections. The professional artists use pigments containing various metal salts such as sulfides, oxides, selenides, or colored minerals of mercury for red, chromium for green, manganese for blue-purple, cobalt for blue, cadmium and iron for yellow, or organic compounds such as sandalwood or Caesalpinia echinata for red.
Traumatic tattoos are classified into abrasive and explosive types. The abrasive form leaves the pigment deposit in the more superficial layers of the skin. Tattooing is performed in black or gray color to cover up any scares or wounds that occurred as a result of an accident or explosion.
Cosmetic tattoos are used with the aim to perform a permanent makeup of the eyes, lips and eyebrows or for breast reconstruction. This has become very famous among celebrities.
Medical tattoos are commonly used to outline permanent landmarks for radiation therapy.
In temporary tattoos, the pigment is applied superficially in the outer layer of the skin. These tattoos are made with henna, a natural pigment obtained from the plant Lawsonia interrums that stains the skin in reddish brown and disappears after 2 or 3 weeks. Lemon, vinegar or tea leaves are used to prevent the deterioration of tattoos, and chemical additives such as phenylenediamine or its derivatives are used for blackening the henna pigment or black henna hair dye.
Performing tattoos consists of introducing a pigment into the skin dermis using a pin. The color pigment is placed between the collagen fibers in the skin's dermis, approximately 2 mm beneath the skin, and deposits the pigment for a lifetime. To place the pigment in the dermis, a technique was practiced in the early era, where the needle made from bones was placed on a stick and the stick was hammered frequently so the pigment could be placed on the skin. It is said that the word tattoo came from the sound that the hand tool makes when it is hammered to the needle stick.
Now the tattoo machines are electrically driven and consist of 3 to 7 stainless steel needles. The gauges of these needles are usually 5, with a length of 36 mm and a thickness of 0.36 mm, and are kept about 0.3 mm away from each other. The speed ranges from 1500 to 9500 strokes per minute, and the depth of needle penetration is adjustable from 1 to 2 mm. More recently, there has been an increase in the number of consumer complaints mentioning adverse reactions at their tattoo sites. The most common reactions were tenderness and itching, associated with allergic reactions, and bumps secondary to granulomatous reactions. The side effects may appear immediately, or weeks or years after tattooing. Many allergic reactions after tattooing are suspected to originate from the metal salts such as chromium, cobalt, nickel. The National Center for Toxicological Research has found that azo pigments decompose into known carcinogens with exposure to UV or sunlight. Cases of transmission of diseases like leprosy, syphilis, tuberculosis, hepatitis, HIV, dermatophytes, and sporotrichosis as a result of breakage of skin barrier were reported.
Tattoo removal has become a major concern because of its permanent character. There are various approaches used for tattoo removal. Mechanical techniques such as salibrasion or water and salts-like substances are used to peel out the upper layers of the skin. Dermabrasion or wire brush or diamond wheels are used to peel out the upper skin. Surgical excision using plastic surgery techniques and lasers. Those mechanical techniques are now abandoned, and laser treatments have become the popular choice of treatment. The lasers react with pigments and break them down into smaller particles which will be removed by macrophages of the skin. The results will depend on the depth of the pigments and color shades. Although laser treatment has become very popular, many complications such as structural changes of the skin, scars, temporary and permanent changes in skin pigmentation may result.
Thanks for watching. Subscribe this channel for watch more videos.